very much, MC, for the good introduction and also for making sure that everyone in the room is getting engaged in the conversations. Dear Executive Secretary of Human Resource for Health, dear Deputy Vice Chancellor of the University of Rwanda, dear Dean of School of Medicine and Pharmacy, dear directors and representatives of hospitals and NGOs present, distinguished academicians, professors, medical doctors, healthcare providers, students, delegates, ladies and gentlemen, a good morning to you all. We are very grateful for your presence here. You have made our scientific conference valued and worthy of your time. It shows how supportive you are, and I take this opportunity to welcome you again to the MEDSAR 25th Anniversary and Scientific Conference 2022. It is a great pleasure to convene here for the celebration to the achievements of what MEDSAR has made over the last quarter of a century in the youth health activism. We have chosen the theme for this scientific conference to be 25 years of youth engagement in health activities. This theme was chosen to reflect on our experiences, the achievements, and what we have gone through over the last 25 years. MEDSAR is an organization, a student-led organization of different medical students and the other healthcare students, which was founded in 1997. It was mainly founded to engage medical students and represent them and making sure that they are much involved into different activities that are promoting health in the country. MEDSAR has been doing several activities over the course of those years, mainly including health education, the awareness campaigns, screening of diseases, and the prevention. Our work has been mainly focusing on different standing committees, as they were mentioned before. We have been a leading youth-led organization with an appreciated impact of health to Rwandans, and this legacy is stemmed from our pioneers and the elders who have given us light, and they have kept supporting us over the course of those years. MEDSAR has a positive impact to the members and the medical students at large. The association provides a platform to the medical students to be trained to serve at an earlier stage. This is a very crucial element in the medical curriculum, as students are being engaged into community medicine earlier at their medical schools. There is no doubt that the medical doctors who are now serving the country and who happen to have been MEDSAR members are serving the country in the health sector with a better understanding of the current perspectives, and also they are providing a holistic care to Rwandans they are serving. As we celebrate today, at this anniversary, I would like to express my heartfelt gratitude on behalf of MEDSAR members and the MEDSAR committee today. My heartfelt gratitude goes to the founding members of MEDSAR, the MEDSAR alumni, different doctors and partners who made this celebration and scientific conference a possibility to us. We started in February with a MEDSAR capacity building camp. We trained around 200 medical students into health leadership workshops. We continued with an open clinic outreach activities where we reached out to 1,000 residents of Kayonza district, and we're here now celebrating this scientific conference as well. I would like to recognize the support received from different partners, starting from the government of Rwanda through its Ministry of Health and Rwanda Biomedical Center, the University of Rwanda, which is our home, the UNFPA, which always supports youth development and their initiatives, WHO Rwanda, Health Development Initiative, Never Again Rwanda, Rwanda Angels Forum, Rwanda NCD's Alliance, Dream Village, and the partners in health who supported us very much in the outreach activities. Now to proceed with, to honor the role of doctors and the founding members in our development, especially the research promotion for the initiative of this scientific conference, we are very much pleased to launch the research program that goes hand in hand with the mentorship and the training and further engagement of medical students. We are planning to do this in order to pay tribute to our forever loved and appreciated late Professor Gautu Jean Bosco, who was a professor of physiology, passionate researcher, mentor, but most importantly, a pioneer of MEDSAR. He has built the spirit of research among us, the medical students, since our foundation. I would like to call everyone here in the room to join me in giving a round of applause, as I believe, for he for sure can see us from where he is, and he will be very, very proud of what this association has achieved. Again, I thank you very much for the continued support and the commitment to help MEDSAR achieve its objectives. I assure you that your investment will bring a lifetime of returns. I look forward to having a productive meeting and celebration with you all. I thank you again.
Thank you very much, and thank you for the panelists for very good presentations that are eye-opening indeed. So, my question goes to Eden. I wish to know, how do you partner with the RBC Centers for Blood Transfusion and hospitals' blood banks to strategize more efficiency? I would love if you could share some of the experience on that domain. Why I'm asking for that is, I suppose hospitals have the obligation to stock blood, and if so, it could be easily accessible to patients in respective hospitals. However, I know there is a very huge question and a challenge we face as clinicians. I used to be managing one of the busiest emergency rooms. One of the challenges we got, I think still this is a challenge, is that we couldn't secure all rhesus negative blood for young women in childbearing age. It has been a very big challenge, and I think Magnifique can be the witness in his domain again. People who suffer postpartum hemorrhages are still suffering for all rhesus negative blood for women. I don't know if you do anything about that, because this is a real challenge, and Zipline could really do a very good job having blood from centers to an end user who needs O negative blood. So if you could share some of your experience. Thank you very much. I forgot to say that I'm Jean-Claude Kiringira, I'm the Dean of the Medical School.
Thank you, sir. So, sorry, you said one question. I'm just going to take this one because I think I need to say something. When after Magnifique speaking, I think we as mentors, is right. We are not doing enough, and I can say one of the things we want to do enough, and we need to really accept that we should have started yesterday. So already today we are late. That's why we should not wake up after 4 p.m. So we need to wake up as early as we can and sleep as late as we can, because we are catching up the time. But one of the things, the difficulties of mentorship is there is kind of a distortion in the concept of research. Someone has planted the seed among the students and even the residents that research equal to money. And when a student is coming to you for mentorship, he's expecting you to give some money. And when you realize that you are not, you don't have money, you don't have a big grant, then that student will not come back to you. So it is becoming difficult to provide a mentorship and justifying that there is no money in this research. We have just to fund some results. So I'm not the right person to speak about the number of papers because I'm sitting close to my professor who has more than 100 papers. I have just 40. But I never got any money for any of those papers I've published. Money, you can get money from something else, but to publish a paper, I never get any money to publish a paper. So the students should understand that research doesn't start with money. Research starts with past experience. You can be lucky, like Magnifique, to get this grant and have good money. That's good, but not always. Start by being interested in something without money. Then after you've been known to do the donkey work and you are good on that, then someone with money can call you to work with him. When I met this morning Eden for the first time, the first question I asked him, can we prove the impact of zipline on PPH in the district? So we have already a question for research. And I told him by the end of this day, we need to find a number of students we can work with on seeing maybe a comparative study during COVID where traffic was difficult. From March to June or to somewhere in 2020, was there more requests of blood? Did we save patient? How much did you deliver? What was the characteristic of the patient in need of that? And compare it with March to June 2022 to see if there is any change and what is the impact. So it's a question, a food for thought for students in this room, so we can make a group of study and work with Eden. So I can mentor you on that.
I'm glad that the research is already, it has a go-ahead, so there's no approval needed, so that's fantastic. Look forward to it. To the question that was asked about rhesus negative blood, this is actually something that we've been talking with Dr. Tom about. We are discussing, we're trying to find solutions. Part of what we do, as you said, every hospital should have storage of blood, local storage of blood. And that's been done over the last 6 years since our involvement. We've actually had one research showing that we've reduced wastage by 67% in general of all blood units. And this is the work that now we are doing with the BTD, the Blood Transfusion Division, to look ahead. The first steps were centralization of the storage of blood. They have a central storage in Kigali from which they deliver to our Mohanza hub and our Kayonza hub. We become the secondary central storage. And the reason for that is because, as you said, we have a quantity issue on Rh negative blood, especially ONEG. ONEG is especially very, very difficult to find. Now, we are doing two things. The first one is coordination in terms of planning with the hospitals. So we've collected data for the past 6 years. So now we are getting to a phase where data should inform decisions. It's impossible to predict how many patients you get, but we can get within a margin of error. So we are working with them to be like, this hospital, this much, this hospital, this much. Dr. Tom's team has been very helpful there. That's on the planning aspect. But then on the second part, and it has to do again with ONEG, we are trying to make sure that we collect more So we work with them on organizing blood drives and community awareness. Because the first part that we notice is that to get this, we need to be very intentional and targeted. To get ONEC blood, to get, in general, rhesus negative blood. So we are trying to see how can we do more in terms of the community, inform the community about this challenge that we have. When we organize blood drives, we have hundreds of people coming, but as we know, the percentage is so low. So now to get rhesus negative blood, we need to be targeted. We need to be like, if you know you are rhesus negative, come. Otherwise, trying to do it over the last few years has shown we still get the same percentage as we have in terms of the population. So we want to do community awareness, we want to do more with outreach, with the blood transfusion division, and of course, keep doing the work. Because now what we are doing is actually reducing. It's unfortunate that you guys have to hear it from me, but we are reducing the number of units that you can request at a time. As a doctor, you have to get at least approval from BTT to get, if it's above 3, we get, you have to talk to BTT, get approval, then they tell us what to do. And it has to do again with reduction of wastage, but also being very specific that you only use rhesus negative for a person who has rhesus negative instead of taking maybe ONEC, because you can use it for anything. We keep that centralized and then we do. But there's definitely more work to do there, and this is like one of the things that we're talking about that we can do research on to see how to improve. But thank you for raising the question.
I would like to thank all our panelists for their wonderful presentations and input. For further recommendations, you can approach them during any break time. So dear youth, the first thing is to just stay curious and be on top. Thank you.
Dear Executive Secretary of HRH and guest of honor, MEDSAR President, and the Chairperson of MEDSAR Alumni, all the healthcare providers present in the room, the colleagues, doctors and the professors from the University of Rwanda here present, the members of MEDSAR, dear students, distinguished ladies and gentlemen, all protocols observed, I greet you all good afternoon. On behalf of the Vice Chancellor of the University of Rwanda, who was invited to this forum, and indeed on my own behalf, it's my privilege and the honor to warmly welcome you at this scientific conference, which is the doubling to take place on a special occasion of celebrating 25 years of MEDSAR existence. I take this opportunity to congratulate everyone who played their role either in the past or in the present, contributing towards the establishment and subsequent growth of MEDSAR. This conference provides a great opportunity for all of us to discuss the role of youth in healthcare delivery, education, and research. For an association like MEDSAR, there could not be a more relevant theme for such a conference. Rwanda is a country that cherishes research for development. In everything we do,
If you want the audience, please step forward. We inviting you to be tonight. Please join our hands for this great event. Please join our hands. It is only this canting, but it means a lot. It means a lot. From the whole team of MEDSAR, we thank you so much, each and every person who participated in this event, from the beginning till now. We're calling upon everybody here to step forward and have this canting done.
When the gentleman asked me to present this paper, I asked him why he wants this research, the link of research and clinical practice. He didn't give me an appropriate answer. So, guest of honor, DVC, and invited guest, MEDSAR, I'm honored to be here to give this talk to MEDSAR. Especially because even the one who authored it didn't know why he wants it, so they don't know what they don't know. That's the biggest problem. I told but I said I will come because MEDSAR was born 25 years ago in my class. So I wanted to be here to talk about research or anything that I can have to contribute. At that time, when I was in medical school like you, I had no clue about research. Zero. So if you don't know anything about research, you are not alone. But you are actually better than us, so don't think like Boris says, we publish over 100 papers. You can even do much better than that. So I want to encourage you guys that it's not difficult to do this. So you can do it, but you need to know your whys. Why do you do research? If you don't develop a clear why, you will never do it. So that's step number one, develop your why. I mean, that is even applicable to anything you want to do in life. If you don't have a very strong why, you will never do it. And the aim should not be, I don't think I have any paper that I published for the sake of publication. It is driven by the why. You want to discover something, you have a question that you want to answer, particularly for me were clinical questions, and then as you follow them, you end up with the result and then you share them, and that's how publication comes out. So it is as simple as that. Break it down, have a desire, have a need, and you go for that.